speaking with Dr. Johan Sundström of Uppsala University, who's presenting here at the AHA a study that's really in the dramatic sweet spot for clinical research. It's addressing the intersection of two of the great epidemics of our time, obesity and heart failure, which is the number one cause of hospitalization in the US and probably in Sweden as well. Tell me about your study.
So we wanted to understand more about the causality of the observed link between obesity and heart failure. And the best way of going about that is to try and remove the exposure and see if the outcome also disappears. So for that we wanted samples that had a large intentional weight loss. And we started out with the Scandinavian Obesity Surgery Registry. And we took out 25,000 patients who had undergone a gastric bypass procedure and had a body mass index between 30 and 50. And then we went to a commercial enterprise called iTrim, who has a structured, intensive lifestyle program. And we took out participants from that database that also had the same body mass index between 30 and 50. And we made them as similar as possible, these two groups of people. So now we have nearly 40,000 people who all lost weight. So now we have two groups who lost a lot of weight intentionally. And we compared the incidence of a first hospitalization for heart failure in these two groups. And the incidence of heart failure was nearly 50% lower in the surgery group compared to the lifestyle group. So it's a pretty dramatic difference in incidence. So it's still observational data. We think a randomized trial large enough to capture effects on heart failure would probably never be done.
Sure.
because now, even though we had 40,000 patients, we still had such a low incidence of heart failure. But I think this is one step closer to causality now, that we don't just have observational associations. We also have, we now have databases where we've taken away a lot of the obesity, and we know that the heart failure was reduced.
What was it about the weight loss that your study indicated was linked to the halved rate of heart failure?
That's a great question, because heart failure is just one of the many cardiovascular adverse outcomes in obesity, and we noted a similar number of heart attacks, a similar rate of heart attacks in both groups. We don't think it was mediated by myocardial infarctions, but our mediation analysis told us that atrial fibrillation, diabetes, and hypertension were three of the more important mediators of this effect. Of course, we also studied weight loss per se, so trying to figure out, is there an effect above and beyond the weight loss, if you wish. And combining these two treatment groups, we noted that for a 10 kilogram achieved weight loss during the first year, the rate of heart failure was reduced by about 23%. That's also a dramatic effect. For every 10 kilos of weight, that's about 22 pounds. Of course, this is just one of the many outcomes in obesity, and when deciding whether to opt for surgery or a lifestyle management program, I think there need to be other data going into those decisions. So we'll be following this sample and investigating all the other possible cardiovascular outcomes, sort of one by one and combined, in order to get the net effects of